Hello and welcome to the Save Your Money, Save Your Teeth podcast series focusing on parafunctional habits, the unconscious or stress-related things that we do with our mouth that can wreak havoc on our teeth, jaws and overall health. If you've already listened to episode 42, you'll know that we took a deep dive into bruxism, that's teeth grinding, and also TMJ disorders, that's the big players in causing headaches, jaw pain and tooth wear. But beyond grinding, there's a whole spectrum of lesser known and often overlooked habits: nail biting, cheek and lip biting, ice chewing and more. And these can be just as damaging over time, leading to chipped teeth, infections, TMJ, strain, and even chronic headaches. So in the next few episodes, we'll uncover these small habits with big consequences, offering practical tips to break them, protect your smile, and of course, save your money by avoiding expensive dental repairs. And joining us again, as always, is Dr. Clifford Yudelman from Optismile, leading digital dentists. Dr. Yudelman, are you well?
I'm good, thank you, Ian. Great to hear you, hear your voice. That was a great intro. I feel like we've already done all 3 episodes. That intro was so well put together, well done. This nail biting one is quite close to my heart because I have some family members that have had all kinds of struggles with it, and it was during last week's episode that I had the idea to do one on nail biting. We do see a lot of it at Optismile, and then the other 2 should also be very good. So I'm all ready. You got some nice questions today.
Yeah, it's going to be very interesting. We often see people biting their nails, and when you look at their nails, you can see it. You never realize how it affects their teeth. So I want to ask you, Dr. Yudelman, why is nail biting such a big problem for your teeth? I mean, it seems harmless to a lot of people.
Yeah, it looks, nail biting looks totally innocent on the surface. It's not like you're chewing on concrete, but from a dentist perspective, your front teeth simply aren't designed to function like built-in nail clippers. You know, over time, the repeated chewing and biting exerts little bursts of pressure on some areas of the enamel, on the edges. It causes tiny cracks and chips. It's like hitting a porcelain mug with a spoon every day. Eventually, you see a fracture. Beyond the mechanical damage, nail biting often triggers gum inflammation, and it definitely causes wear. It will shorten the edges of your teeth if you're constantly nibbling on your nails. And let's be clear, this includes cuticles, people that bite on cuticles, which I think can sometimes be an even bigger problem because the cuticle is softer and then you tend to rub your teeth together more as opposed to just picking off bits of nail. And, despite being a small habit, the cumulative effect is huge. It's essentially micro trauma happening thousands of times over months and years that can cost you big money once the real damage shows up in cracks or broken front teeth.
And what kind of damage can nail biting actually do to your teeth over time?
It causes your teeth to develop micro cracks and chips at the incisal edge. That's the biting edge of your front teeth. They are often invisible at first until one day you bite into something firm and a piece just snaps off, or you suddenly experience jarring sensitivity. It also accelerates general wear and tear on the enamel and makes the teeth more prone to staining and picking up cavities right on those edges. It can actually shift the position of your teeth. As your teeth wear down, they keep erupting, so they keep touching, and you don't realize that your teeth are getting shorter and shorter, but the biting edge isn't wearing away. You don't notice it because they erupt. And so many of the cases we see at Optismile for Invisalign is from this type of wear. And, if you've had orthodontic work such as Invisalign or braces, constantly biting nails can definitely cause problems applying forces in a way your teeth aren't expecting. And definitely if you have composite bonding or veneers on the front teeth, you will risk fracturing that expensive dental work it's a slow, stealthy form of self-inflicted damage.
Sure, it sounds serious. Also want to ask you, Doctor, any risks beyond your teeth, like for your gums or your jaw?
Definitely for the gums, bits of nail can get stuck under your gum. I've seen teenagers that have had gum infections. You also have patients getting a repeated trauma or occlusal trauma to their teeth, and if they have some gum problems, the teeth can actually get loose, or it can cause the bone to deteriorate worse in cases where there is a gum problem. And from a jaw perspective, the repeating biting motions will contribute to muscle tension. It's not as forceful as full-on clenching or grinding, but it's a repetitive stress, and people might keep biting harder and harder, and it aggravates the TMJ. And, you're putting your jaw off to the one side or the other to be able to get your teeth together. And I see a lot of patients that have a problem on one jaw or the other. And then I ask them, I can see, look down, I see they've been biting their nails. Or we're also going to be talking about lip and cheek biting in the next episode. And I can see a little callus on their lip. And I say, oh, just bite your nail for me like that. And then they go, ow, their jaw actually hurts when they go into that position. Sure. But when they do it subconsciously, they don't realize that's what's causing the problem.
Cosmetic problems, especially for people who've had Invisalign or veneers, can nail biting cause cosmetic problems?
Absolutely. If you've invested in Invisalign to straighten your teeth, nail biting can gradually shift those teeth out of alignment because you're applying constant micro pressure, and you're also wearing those teeth away. It's like pushing on a fence post a little bit every day. Eventually, that fence post will tilt. Even if you're wearing retainers, it's not 100% guarantee if you're going during the day, putting excessive forces. For veneers or bonding, the risk is even scarier. Veneers, especially porcelain veneers, are thin shells, and they're very strong overall, but they're vulnerable to chipping at the edges if they're being used as a nail clipper. And composite bonding can also fracture and separate from the tooth, and we see that with injection molded composite bonding. 9 out of 10 times if someone does have a chip, it's because they forgot not to bite their cuticles or bite their nails. They bite their nails, and sure enough, they chip the bonding. At Optismile, we warranty our bonding, our injection molding against those kinds of accidents, unless a person's doing it repeatedly. Yeah, if you spend good money on a smile makeover, you don't want to ruin it with a simple, unconscious habit. That's very hard to kick. People have a very hard time, and we'll get into that later.
Well, very often you hear people say, oh, that was a nail-biting experience. And when they say that... When they say that, it means it was stressful, or they were anxious. So we know that nail biting is linked to stress or anxiety. But do people actually even realize that they're doing it?
Oh, that's a great question. So, yes, it's heavily linked to stress, anxiety, or boredom. Many patients don't realize that they're biting their nails, except when they look down and they see the physical consequences, the rigid nails, the ragged cuticles. Sometimes they're even bleeding, I've seen some terrible cases. And then they don't realize that they're actually chipping and wearing their teeth. They think all they're doing is picking off some nail or cuticle and it's growing back. These habits often start in childhood or teenage years during stressful exam periods. Continues into adulthood. I think it's also genetic or runs in families. If you see your parents biting their nails, I do know of one particular family where the father and a couple of the adult children, and now actually the grandchildren, all bite their nails. So I think there is a family or maybe even a genetic mechanism there. It becomes an automatic coping mechanism. If you're stuck in traffic or waiting for a meeting to begin, the next thing you know, your nails are in your mouth, and it's an autopilot effect that makes it so challenging to break.
I'm wondering, the ladies with the beautiful nails and the cuticles, they're obviously not nail biters, because, that's never going to work if you're a nail biter.
Yes, and that's actually a way even for males to stop biting their nails, is to actually have a manicure. Grooming for men is becoming popular.
Yeah.
And if you spend a lot of money getting your nails buffed and done up, you tend to look after them, better. I'm not saying that's for everybody, but I have seen cases where people stop biting their nails after getting a few manicures and putting moisturizer on their cuticles. There are things that a beauty therapist can do to help you look after and be proud of your nails. I think if you're going to an interview and the interviewer sees your really chewed up fingers, they're going to think, oh, this person is maybe very nervy or could be unreliable or highly stressed. You could sit there and try and look chilled, but when you see someone's and also chipped teeth, almost always if people are bad nail biters, you almost always see damage on the front teeth, makes them look much older.
Yeah,
and there's little chipped edges. Yeah.
But doctor, surely there must be some health risks from putting your fingers in your mouth all the time, right?
For sure. If you remember during COVID, the one thing we did was wash our hands all the time. You're picking up millions of bacteria and viruses every day from doorknobs. I mean, I don't know how many times I've been to the men's bathroom, at the movies or whatever, and then you see people leaving without washing their hands and touching the doorknob. The next thing you're also touching the doorknob, and then you go and stick those fingers in your mouth. That's a bit gross. You don't know you don't know what you've just touched. And also telephones. Just when you go up an escalator, you got your hands on the escalator, and then next thing you're biting your nails. Put your fingers in your mouth. You're putting those germs. There's something called norovirus. It's a gastro. And it's very infectious, and I think that's passed, hand to mouth, as well as your everyday E. coli and different kinds of diarrhea type infections, tummy bugs. And people can get severe fungus and problems with their actual nails and cause all kinds of deformities, even if they stop biting. You're getting oral bacteria into those wounds around your fingers, and it's a two-way street. And, like I said, with COVID awareness, people have realized how many times they touch their face or their mouth, and nail biting is like an open invitation to the germs.
Yep, and then you wonder where you got that cold or COVID or whatever from, or that nasty flu.
Yeah.
You don't even know how you picked it up. Dr. Yudelman, how can someone tell if their nail biting is already causing dental problems?
Yeah, so if you look in the mirror, if you look at your front teeth under good light, sometimes, if you look in the rear view mirror of your car, because it's very bright in your car, especially if the sun's shining through the windshield, and you can get up really close up to that little mirror, and it's a very good quality mirror, the car rear view mirror. In a bathroom and that, it's like double. Sometimes there's an extra reflection. But if you look at the edges, are they ragged, are they chipped, are they showing hairline cracks? Are you experiencing unexpected sensitivity when you bite into crunchy foods or bite with your front teeth? And does your dentist keep mentioning chipped edges or even say to you, it looks like you're biting your nails again? That's a dead giveaway when the dentist says, oh, you're biting your nails. That should wake you up a bit. You might also notice your gum line is a bit irritated, and definitely you look at your nails, you'll know that you've been biting them because you've got ridges and maybe even some of these little infections that I mentioned. And your nails will be short and painful, and your front teeth are likely taking a beating too. Listen to what your dentist is telling you. We see these types of things every day.
And Dr. Yudelman, what can people do to stop nail biting? Do you have some practical tips for us that will actually work, especially for those at their wits' end?
Yeah, the first thing, as with any of these things, is an awareness. Step one is noticing each time you put your fingers in your mouth, and people will often catch themselves halfway, just about to put their finger in their mouth. Another one that's tried and tested is a bitter nail polish. They make a special nail polish that you paint on your nails, and it tastes terrible, and it can break the habit because if you do forget and you subconsciously put your nails in your mouth, you will know, sure enough, unless you come to enjoy that bitter taste. Stress management. If anxiety is a trigger, then therapy deep breathing, maybe a fidget toy, seeing a therapist. Some patients have got like a type of OCD problem and they actually need medication, and it's not just nail biting. They have other issues that can be treated as well, because the nail biting is just part of a general anxiety. Keeping your nails trimmed, less temptation to bite. Like I mentioned, having a manicure. People really want to ruin a nice, expensive manicure. A reward system, setting small goals. Like if I go 2 weeks without biting, I'll treat myself to something nice, maybe a gold Rolex or something like that. That should get you to stop your nail biting. Just kidding. I'm not really a fan of fancy watches, but I used to always tell people to get one of those post office elastic bands, one of those really thick ones, those big, thick, heavy elastic bands, and to wear it on your wrist. Do you know how that one works? How does that stop you from biting your nails? Have you got any idea?
No.
So what you do is you put this thick elastic band around your wrist, and the first time you catch yourself biting your nails is you pull the elastic band all the way back, at least 12 inches. I don't know how many centimeters that would be. I'm still giving away my age here, but the length of a ruler. And you close your eyes and you let go, and I promise you won't put your fingers in your mouth again. It's a punishment.
Jeez.
But you got to just keep wearing the elastic. As long as the threat is there, you should. Every time you're about to put your fingers in your mouth, you look at that elastic. You don't want to pull that elastic back again. So I've known that to work for a number of people. I've recommended it to. You have to make them do it the first time in front of you, but it's not for everybody. I don't condone violence, but it does work.
I was going to suggest a shock collar.
Yeah, that also works. Yeah.
Okay, but when would you say, Dr. Yudelman, should someone see a dentist, and what can Optismile do to help a nail biter protect their teeth?
It's a good question. If you notice chipped edges or ongoing sensitivity, if your front teeth are wearing down or changing shape, then it's time for a checkup. If you come to Optismile, we can do things like smooth out existing chips or do minor bonding, what we call edge bonding, freehand bonding, to prevent further chips and cracks. We can assess your bite to make sure there's no bigger alignment issue. If you've got a problem where your teeth have worn down and you now have an edge-to-edge bite, you may need some alignment like Invisalign, or possibly to build those teeth up with more extensive bonding, or in the case of Optismile, we do a fair amount of injection molded composite bonding. We've done a whole lot of episodes on those. I know there are dentists that recommend veneers. Patients go in with minor chipping, and these dentists, if you're out there, you know who you are. They do a whole PowerPoint presentation and they show the patient how the wear is damaging their teeth, and then they show a picture of someone maybe 10, 20 years down the road with terrible damage, and they scare people into getting veneers. These are people who may be interested somewhat in some cosmetic improvement, but they get scared into drilling down their teeth and putting on veneers due to nail biting, which isn't really the answer, because if you bite your nails and you have veneers, you will chip them and break them off. And in the case of Optismile, the laboratory fee alone, the lab charges us around 5,000 Rand per veneer. That's before we even charge you 1 cent. That's one of the reasons why we don't do a lot of ceramic veneers, because if someone does chip or break them, it can be very expensive to repair them. Injection molding is very quick and easy to repair. But people who bite their nails and don't stop, they do tend to get a lot of chips. And, the behavioral tips, we can help with that. We make retainers. Some people wear a retainer during the day and then a bite guard or bite splint at night. That really works. Wearing gloves, or especially if you get into bed, you can wear, thin gloves that stops you from actually biting your nails in bed. Early intervention can save you from needing big restorations or cosmetic corrections later on. So the sooner the better, I guess.
And maybe some final advice, Doctor. What would you say to every nail biter listening who wants to save their teeth and also their money?
Yeah, I mean, that's the theme of our podcast. Save your money, save your teeth. And nail biting is a classic example of a tiny habit with big consequences. It feels so trivial, but it snowballs into serious damage, and stopping sooner rather than later can literally save you thousands in restorative dental work and pain and suffering. So find out what triggers you. Try the bitter polishes. They sell them everywhere online. You can get them at Clicks, Dischem. Keep a stress ball at your desk. Anything to keep those nails away from your enamel. Try the rubber band if you can find a post office these days, or maybe someone has one of those thick rubber bands. Remember, it's got to be one of those big, thick ones. Remember, your teeth are for smiling and chewing food, and they're not there for personal grooming or to be used as a nail clipper.
Yeah, and don't reward yourself by chewing some ice. I mean, that's another problem. We'll talk about that.
Yeah, we're going to get into
in
that in the next episode or one after that, yeah.
So next week, Doctor, we're talking about cheek and lip biting. Is that correct?
Yes, cheek and lip biting. It's a different story, but similar.
Okay, that's going to be interesting. But thank you so much. Very, very insightful once again, Dr. Yudelman. And also to our listeners, thanks for joining us. And remember, while we strive to provide valuable insights, always consult with your own dental professional for advice tailored to your personal health. And don't forget to subscribe for more enlightening discussions. And join us again next time as we continue to explore the fascinating intersection of dental health and financial savvy. Until then, keep smiling and taking great care of your teeth, and stop biting those nails.
Discover the world of dental excellence with Optismile. Join us for a weekly podcast featuring Dr. Clifford Yudelman, a seasoned expert with 40 years of dental experience across 4 continents. Gain unique insights and expert dental advice by visiting optismile.co.za for articles that illuminate the path to optimal oral health. If you're seeking unparalleled dental care in Cape Town, get in touch with Optismile or book directly online on optismile.co.za. Optismile, where global expertise meets local care.